Hey there, my name is Casey Green. I'm a clinical pharmacist and functional medicine practitioner. Today I'll be covering IV nutrition therapy specifically as it relates to antioxidants and amino acids. So let's get started. So as far as antioxidants and amino acids, we'll look at conditions that may benefit from IV or injectable therapies. We'll look at testing and monitoring antioxidants and amino acid custom protocols and benefits of particular ones, as well as some basic safety clinical pearls to be aware of and some case studies just to show you how these might work. Now, before I get too deep into this, I'd like to note that amino acids can be antioxidants and vice versa, as the term antioxidant simply describes a molecule that performs a specific type of activity, whereas an amino acid has a specific foundational chemical structure and could potentially act as not only an antioxidant, but many other things as well. So let's get started. What are antioxidants? They're simply substances that can prevent or slow damage to cells caused by free radicals, which are unstable molecules made by the process of oxidation during metabolic processes. So antioxidants are most commonly found in foods, notably fruits, vegetables, and other plant-based whole foods. Unfortunately, most people don't get nearly the recommended amounts of fruits and vegetables, nor any significant variety of them that they really need. For this reason, supplementation can be extremely valuable. Before we get too deep into antioxidants, though, let's look at why we need them. So what is oxidation? To answer that, we need to look at the opposite of antioxidation, which is, of course, oxidation. So we've all heard of oxidation and get the general idea that it's not good, but what is it? So it's the process by which electrons are lost during a reaction by a molecule, atom, or ion. Doesn't sound too bad, but while oxidation is a natural part of metabolic processes, and it's actually needed to a limited degree, if it's left completely unchecked, oxidation can increase the speed of aging as well as the risk of various disease states. The opposite process is where electrons are gained by a molecule, atom, or ion, and this is called reduction. This is the role of antioxidants, and this is how they keep oxidation in check. So when free radicals outnumber antioxidants, you could say the body is in a state of oxidative stress. So this can eventually lead to DNA damage and an increased risk of cancer, heart disease, and many other disease states. So what causes oxidation? So various lifestyle and environmental factors, a lot of different things can technically cause oxidation. And again, it is ongoing in our body at all times. But some common examples would be high intake of polyunsaturated fats, such as processed vegetable oils that are used to fry a lot of the foods we eat, especially fast foods. This leads to a high omega-6 versus omega-3 state and a lot of inflammation. Other possible causes can include infections, high blood sugar levels, environmental toxins, air pollution, smoking, radiation, even including excess sunlight and alcohol intake. So here, just looking at some of the top antioxidants that might be used in IV or injectable therapies. So glutathione is the primary intracellular antioxidant and is essential for life. It's made from 3 amino acids, glycine, glutamic acid, and cysteine. It is also a chelator of heavy metals. It's needed for white blood cell production and has potent antiviral activity. It's easily one of the most important compounds in the body for fighting off cancer daily due to its essential antioxidant activity. And levels decrease as we age, so supplementation can be very beneficial. Vitamin C, or ascorbic acid, is an antioxidant, as well as a cofactor, such as in collagen creation, and a chelator. And a special note, it's only an antioxidant at low to moderate dosing via IV, and we'll get more into that later. Now, acetylcysteine, aka NAC, is a precursor to glutathione and increases glutathione levels. It's known as an antidote as far as arsenic. It's a chelator there, and antidote for acetaminophen toxicity, as well as a mucolytic agent. NAD plus is an antioxidant. It's heavily involved in DNA repair via PARPs, or poly-ADP ribose polymerases. It boosts ATP production to increase the usable energy levels from the foods that we eat. Then we've got alpha lipoic acid. It's a powerful free radical scavenger with other benefits, such as supporting healthy blood sugar control and patients with peripheral neuropathy. Then selenium is a mineral with potent antioxidant activity. via activating selenium-dependent enzymes or selenoenzymes. Selenium's antioxidant function critically supports both thyroid and gonadal health, playing an important role in ensuring optimal hormone function and output. So these are some of the most notable antioxidants used in outpatient IV nutrition practice, although many more exist. So now on to amino acids, which again can often act as antioxidants, but have a specific structural definition. So amino acids are organic compounds containing amino and carboxylate functional groups at its core, but also a side chain specific to different amino acids. And the side chain, or R group, is what gives individual amino acids their unique characteristics. While the primary function we often think of amino acids in is that of building blocks of proteins and therefore our body's tissues, this is not the reason we're primarily talking about amino acids in this webinar based around IV nutritional therapy. Most people will get the amino acids they need as building blocks through various protein-containing foods in their diet, or if via IV route, it's only after several days of being unable to eat. Those would be the amino acid blends we think of as going with a TPN or total parenteral nutrition, most commonly in the hospital setting, but also in acute home health care situations. Instead, our interest today is in amino acids for this discussion lies in their metabolic functions, such as synthesis of hormones and neurotransmitters, and of course, their critical roles in metabolism. This is where we can utilize either single amino acids or specially selected combos of amino acids to achieve a unique and powerful effect on the body via IV or IM use. Now, there are 20 different primary amino acids the body needs to grow and function properly, 9 of which are essential because the body cannot make them, so they must be obtained through diet or supplementation. Additionally, there are over 500 known naturally occurring amino acids. But just because the other amino acids beyond the 9 aren't labeled quote unquote essential by official definition, they are essential for the body to repair and function properly and optimally, and oftentimes need supplementation to achieve optimal function and maximum quality of life. Now, some top amino acids, we've got glutamine, which is the most abundant amino acid in the body. It's essential for muscle synthesis and recovery, as well as being a critical fuel source in the immune system, intestines, and colon. It also supports the excitatory side of the nervous system. Then we've got arginine supporting growth hormone levels and therefore muscle recovery and tone. Also supports vasodilation and therefore healthy blood pressure and nutrient transport by acting as a precursor to nitric oxide. And notably, the importance of this nitric oxide pathway is so great that the Nobel Prize was awarded in 1998 for its discovery. Arginine also can chelate ammonia, which is critical for health. Now, ornithine also has related functions and similar benefits to arginine, and also supports a healthy sleep cycle and tends to work in good synergy with arginine. Lysine is needed in collagen synthesis, so it's critical in joint repair and maintenance, and it also has the benefit of suppressing viruses such as the herpes virus. Leucine, isoleucine, and valine are known as the 3 branched chain amino acids and are heavily involved in protein synthesis and therefore muscle tone, growth, and recovery. Leucine is the primary amino acid that is known to stimulate the mTOR pathway, which is what signals our body to repair and build muscle. And isoleucine and valine play critical supporting roles to leucine in this pathway. So in a nutshell, the 3 branched chain amino acids are critical in muscle growth, decreasing muscle soreness, reducing exercise fatigue, preventing muscle wasting, as well as supporting liver health. Levocarnitine helps increase fat lipolysis and energy output, so it's great for supporting weight loss and chronic fatigue. Then we've got taurine, which is actually the master osmotic regulator in the body, helping electrolytes like magnesium, calcium, potassium, and so forth to properly cross cell membranes for optimal electrical function. An example of this could be the heart, because we always think of the heart as needing proper electrical conduction to beat properly. Taurine is also critical and can be used heavily in supporting eye health. Then we've got glycine, which supports nervous system relaxation and is actually required for glutathione and creatine synthesis. It supports the conjugation phase of detox in the liver as well. So now some conditions that may benefit from IV therapy with antioxidants and amino acids. So notably, antioxidants have a more similar benefit across the board since the group is based on their activity. So all health conditions could theoretically receive beneficial support from antioxidants, as too much oxidative stress on any cell in the body could obviously have negative health effects. With that said, though, the following list are some more common conditions in which IV antioxidant therapy is successfully utilized for support. Amino acids, on the other hand, can again often act as antioxidants, but also serve a wide array of other functions. Function is widely variable depending the specific amino acid, but the above are some more common conditions supported by IV or IM amino acid supplementation. Amino acids can serve in both building block and metabolic capacities. Now we'll quickly look at a case study example here. So this patient received this regimen along with a low carbohydrate diet with a daily calorie range of 1,500 to 1,800 calories and moderate intensity exercise 3 days per week. It was a 50-year-old female, and her fasting blood sugar was in the pre-diabetic range to begin, with a goal of non-diabetic at less than 99 milligrams per deciliter. And her A1C starting at 8.3, the goal is to get below what the guidelines recommend of less than 7.5%. And the treatment was to be alpha lipoic acid IV infusions at 250 milligrams in a 250 ml D5W IV bag given over 1 hour, this at 3 times per week for 3 months. So the results after 3 months, the patient's fasting blood sugar was down to 97 and the patient's A1C down to 7.6. Also notably, her weight went from 186 pounds to 163 pounds. This overall showing a strong trend for the antioxidant alpha lipoic acid to support healthier blood sugar levels and weight loss as part of a plan including a reasonable diet and exercise. Now we'll look at some testing and monitoring that might be related. So blood serum, while it's of course recommended to get a general medical lab workup on patients, such as a comprehensive metabolic panel, CBC, and urine dip, there's actually little application for antioxidants and amino acids specifically with typical blood serum testing. And the same goes with blood spot application as well. Saliva testing, there's not much application in most cases there either. White blood cell can be one of the more useful. It can be used to assess intracellular antioxidant levels such as glutathione. And again, while not necessary, it could prove helpful in patients willing to go that deep and really look at fine-tuning things. Then urine sample can be utilized for things such as neurotransmitter testing, which again, while not necessary, could possibly lend its way to a more specialized amino acid supplementation. The bottom line, though, being that lab testing is not required beyond a general medical workup, which we of course recommend in all patients, and it's often not able to further specialize IV antioxidant or amino acid therapies, though in some cases, white blood cell testing or specialized urine sampling can offer further optimization where major deficiencies exist. So now we'll look at a few examples of very beneficial antioxidant and amino acid custom protocols. It's worth noting, though, that many of these amino acids will have the most optimal effects when combined with various B vitamins, as B vitamins have a critical function in amino acid metabolism. So for example, vitamin B6, aka pyridoxine, is the most important vitamin for amino acid metabolism at large. So it'll have a very synergistic effect in combination with many amino acids, especially if the patient isn't getting much B6 from their diet. Another important example would be B2, aka riboflavin, being necessary for glutathione reductase and getting the full antioxidant benefits of glutathione. So now let's dive into a few examples. So ascorbic acid, aka vitamin C, is one of the best known antioxidants. It's very important to note, though, that what we call high-dose vitamin C therapy is not antioxidant therapy. At approximately 10 grams, which would be 20 mLs at a 500 milligram per ml concentration, IV vitamin C becomes more and more of an oxidative therapy as the dose is increased. The exact opposite of what we typically think of with vitamin C, right? So oxidative therapy has a proper place and use as well, but will not be covered in depth during our antioxidant discussion here. High-dose vitamin C as an oxidative therapy will be covered in great detail in an upcoming webinar, but is worth briefly mentioning here just to clarify this important distinction. Typical low-dose antioxidant vitamin C regimens range from 1 to 10 mLs, but might in some cases go up to 20 mLs. This will be diluted in the appropriate sized IV carrier fluid bag with or without other ingredients. Most patients will not tolerate ascorbic acid given via IV push or intramuscular injection, as the hypertonic fluid is not optimal for such use. For this reason, ascorbic acid diluted and given via IV drip is most optimal. Now, note that ascorbic acid comes in both multi-dose and preservative-free versions, with the multi-dose version typically intended for multiple antioxidant uses and the preservative-free version as a single high-dose oxidative drip. Now, despite all the fads and scams out there based around detox treatment, glutathione is the legitimate master detox molecule used by the body every day to help the liver and actually every single cell in our bodies to detox and keep us safe from the many harmful chemicals we intake through our diet and our environment. So needless to say, most of us nowadays likely eat and suffer exposure to more harmful chemicals than our bodies are naturally designed to handle. So glutathione supplementation can offer critical support to the liver and every cell in our bodies through the true detox process. Glutathione is typically administered via slow IV push through the IV line's Y site, either before or after an IV drip or alone, but not mixed in an IV bag with other ingredients. Glutathione can easily lose its antioxidant capabilities when exposed to many chemicals, so it's generally not worth risking the incompatibility by mixing it in the bag with other ingredients. Most protocols range from 500 to 2,000 milligrams, and with the highest safely tested dose at 3,600 milligrams in neurological disorder studies. Innovation's glutathione is at 200 milligrams per ml, and we recommend diluting the glutathione 1-to-1 with sterile water for injection to lower the osmolarity, as well as slow pushing no more than 1 ml per 30 seconds. This is to avoid irritation to the peripheral infusion vein and lower risk of adverse events. Patients unaccustomed to IV glutathione should be titrated and monitored before using higher doses. This is to assess the patient's reaction to a rapid intake of the large sulfur quantities involved, as some patients can rarely experience respiratory reactions to the sulfur content. Now, NAD plus is a potent antioxidant option, but it also offers many other huge benefits related to anti-aging and boosting energy. As mentioned before, NAD plus is needed for PARPs, or poly-ADP ribose polymerases, which are enzymes that help repair DNA, as well as play critical antioxidant roles. This lends NAD plus to its very popular role in anti-aging medicine. It additionally supports the ATP creation process, so therefore is critical in taking those foods that we eat, those carbs, fats, and proteins, and then turning them into usable energy. This has made NAD plus extremely popular in fighting chronic fatigue. So acetylcysteine is a very, very noteworthy antioxidant as well. It's very well known to boost glutathione levels, as well as offer strong immune support. This one, unlike glutathione, can be added to the IV bag and is in many common drip mixtures. 1 to 5 mLs is what's commonly added to the IV bag. And its antioxidant activity is actually so strong that acetylcysteine is used in treating acetaminophen overdose in the hospital setting and can do so very successfully. Now looking at some combo blends of amino acids, Goal and Alive are two very popular options. So Goal is a combination of glutamine, ornithine, arginine, and lysine. These have already been individually covered earlier, but just to recap, this combo should offer strong support of physical recovery, muscle tone and performance, healthy growth hormone levels, support joint health, as well as vasodilation and heart health. And then we have Alive, which is a combination of arginine that goes with our branched chain amino acids of leucine, isoleucine, and valine. Again, these were individually covered earlier, but just to recap, this combo offers strong support for muscle growth and repair through stimulation of the mTOR pathway for protein synthesis. Also supports healthy growth hormone levels and physical recovery, as well as vascular and heart health via the nitric oxide pathway to vasodilation. They're both typically given in 1 to 2 ml intramuscular 1 to 2 times per week treatment regimens, but IV use is possible as well. Now, just a brief note on drug compatibility. You do always want to make sure that you check available data when adding other drugs to IVs, and especially, again, take caution with glutathione, as it can lose its activity when combined with a number of other mixtures. For this reason, glutathione is typically given alone, but it is important to note that you should check with any ingredients that you use that they have good compatibility so that the patient is getting the best benefit. and nothing salts out of the bag. So now some other clinical safety pearls to just always keep in hand. So we always recommend a basic medical workup. I mean, we just need to know if the patient can handle fluids and electrolytes properly. For example, patients with heart failure or renal disease could have issues with clearing the various fluids or managing electrolytes properly, even in some of these types of drips. We generally recommend ACLS certification and a stocked crash cart at all times. While very rare, emergencies can always happen. For example, any ingredient could propose a risk of an unknown allergy to an otherwise, being a harmless ingredient the majority of the time. So it's just best to always be prepared in that case and have training, as well as the proper drugs on hand in a crash cart. As far as incompatible ingredients could cause not only potency issues, but salting or other compatibility issues where components can come out of the solution. For example, alpha lipoic acid should never be mixed with other ingredients as it might not stay in solution. Then we have osmolarities being too high, which can potentially damage peripheral veins. And then osmolarities that are too low can cause hemolysis or rupturing of red blood cells. Then various ingredients just have unique side effects that are largely avoided by understanding how to best administer and monitor them. For example, titrating glutathione to avoid those respiratory reactions where some patients have that sulfur content sensitivity. So just know the potential side effects of the ingredients and overall how to handle them. But these offer some of the key areas to just be aware of. And if you're pretty good with these areas, you should generally be able to handle outpatient IV nutrition therapy pretty safely. So in this case study, we'll look at a 28-year-old female. She was working in a high pressure professional environment, was experiencing increasingly severe chronic fatigue, which was beginning to have a significantly negative impact on her work performance. She was seeking something to help get her energy and focus back on track and to help her better keep up with life's increasing demands. So the provider chose to give the IV regimen above of NAD plus at 250 milligrams and 500 mLs of normal saline over 2 hours. And this being done 2 times per week for 4 weeks, and then going on to a 1 time per week maintenance level. The patient noted significantly increased energy and alertness during even the first infusion, as well as on an ongoing basis. In fact, by the time the patient was in the once weekly maintenance phase, she reported having significantly less fatigue throughout her average workday, as well as feeling more capable of excelling in her work responsibilities. Then in this case study, we've got a 59-year-old male complaining of having chronically sore and achy muscles and joints. He felt that he couldn't seem to ever fully recover physically and always felt broken down no matter the amount of rest. The patient was already exercising 3 to 4 days per week. So the practitioner started the patient on the following amino acid combo injectable, which we abbreviate to ALIVE. This is short for arginine plus our 3 branched chain amino acids, leucine, isoleucine, and valine. Now, going back to what we discussed earlier, arginine provides support for both healthy growth hormone levels, which are very important for recovery, as well as vasodilation to support healthy blood flow. The branched chain amino acids, especially leucine, stimulate the mTOR pathway, which tells the body to synthesize muscle and connective tissues, thereby supporting physical recovery and muscle tone. The patient was able to do this intramuscular regimen from home and started with 2 mLs intramuscular twice per week through month 1. He continued his exercise regimen of 3 to 4 times per week, which consisted of mostly resistance training, but some light cardio as well. The patient was additionally instructed to get 0.5 to 1 grams of protein per pound of body weight per day. So in this case, 90 to 180 grams of protein per day since the patient weighed 180 pounds. This would give his body the building blocks needed to repair itself, and then with the ALIVE formula providing a boost and encouraging the body to do so by stimulating mTOR. The patient reported back to the practitioner after roughly 1 month and reported that he finally felt he could recover from his busy days and workout program. While he still had somewhat achy joints, that was attributable to arthritis expected at the patient's age, but his muscles especially felt stronger, less sore, and just overall better per the patient. And last reported, the patient had maintained the ALIVE regimen past the 6-month mark and felt it was a crucial part of his overall plan to slow aging and keep strong and healthy overall. So again, I'm Casey Green, clinical pharmacist and nutrition specialist at Innovation Compounding Pharmacy. Please reach out to us if you need any help in using IV antioxidants and amino acids to meet your business and patient needs. Thank you.
Thank you for listening today. Whether you are looking to expand your practice by adding an IV nutrition therapy segment, or you currently provide IV services and just want a refresher on the topic, this presentation was designed just for you. And education and information training like this is what the Innovation Institute is all about. If you enjoyed this lecture today, I urge you to sign up for future lectures to learn more about the topic. You can do so by going to our website at www.innovationcompounding.com/institute. As always, the pharmacy team at Innovation is here to answer your questions and accept your feedback. So please reach out to us. Thank you again for listening today, and be well.